welcome to the Let's Talk series. This month, we decided to have a nice little Let's Talk conversation with myself, Dr. Becca, and Dr. Amanda.
Hi.
So today we decided it would be a good idea to just kind of take it back to the basics. A lot of the Let's Talk series that we've been doing, we've been meeting with a lot of wonderful pelvic health practitioners, both local to South Jersey. We've even had someone from Texas, and I know we're going to be doing one with someone from Hawaii coming up later in the year. So it's starting to expand worldwide, but a lot of those have been about very kind of like specific topics, very specialized topics. So we thought it would be good to just kind of bring it back to the basics and just talk about the pelvic floor in general and the 5 functions of the pelvic floor. So that's what we're going to be talking about today. I thought it would be a good place to start. How often when, we have clients coming in and we're talking about pelvic floor therapy and going through all the anatomy and stuff like that, people kind of pause and stop me and say, so what is the pelvic floor? Like I feel like you hear that, like it's a buzzword, you hear it a lot, but like, what even is the pelvic floor? It's kind of sometimes just thrown out there of things of like, similar to like your core, or like you're this or you're that. So what do you tell clients when you get asked that question or when you're talking about the pelvic floor?
Yeah, that's such a, for example, going to like a baby shower this weekend, it was like, you do pelvic therapy? And that same question came up, and it's like, well, there's, I kind of say that there's lots of functions of the pelvic floor. And I think most of us understand the pelvic floor to be a group of muscles that does something. And then if that something is usually like peeing our pants, but there's so much more to the pelvic floor that, we're going to talk about today of the other functions that obviously the pelvic floor muscles help to keep us continent and keep things closed when they're meant to be closed. So we're not having gas leakage, or we're not having urinary leakage, but there's a lot of balance. That's kind of how I like share about it. It's there's balance that needs to occur in the muscles, from the outer muscles to the inner muscles, from the front to the back musculature, going from the pubic bone to the tailbone, that do so much more. So kind of everything in your seat, as well as it's a partner to the rest of our core, right?
Yeah.
So how do you explain it?
I mean, it's the same.
Yeah.
I think most people are surprised by like the pelvic floor is actually a muscle group. Like there's multiple different layers with multiple different muscles within the pelvic floor that all do multiple different things. And like you said, it is actually part of your core. So that's one of the examples that I use when people are like, what is pelvic floor? I'm like, it's the same thing as like, what is your core? A lot of people, when they think of core, they think of like their abdominal muscles.
Exactly.
But we know the core is a whole kind of core canister system, with your pelvic floor literally being like the floor of that.
Right.
So, and I think, people are always surprised to learn that it's more than one muscle. There's, how many did we count that one time when we did that like trivia? At least like,
oh, I know. I always forget the exact number.
I mean, we can go through and like count
right.
But there's
a right and a left side too. Like I think people forget there's also a right and a left side.
Yes, right and a
left. We're counting muscles. Yeah.
Yeah. And then the 3 different layers as well, and kind of how each of those layers can translate and involved in each of the 5 different functions as well, because
absolutely,
some of they all are separate individual muscles that do different things, but then work together kind of as a whole group. So you had kind of mentioned, I think, like the most obvious thing that people think of with like the function of the pelvic floor is the sphincteric function. So when when you're in the pelvic floor classes or PT school, you learn the 5 S's of the pelvic floor. Yeah. So there's sphincteric, sexual, support, stability, and sump pump.
Yes, that's my favorite.
Yeah.
Do you have a favorite out of those?
Yeah. So I think the sphincteric and the sexual are like the more obvious ones. Maybe support, people might guess that one if they had to guess. Right. It always takes me back to when I was in PT school, we had our like anatomy cadaver lab, like the practical. Remember, we had like the little pins in different parts of the cadaver, and it would say like, what does this muscle do? Or what is the function of this muscle? Well, one of my classmates she mistakenly thought one of the pins was in the penis. And the question was like, what is the function of this muscle? And so, but I think it was for like the bicep actually or something.
Oh,
So,
geez.
after the test, we all like walked up,
Right.
we're all talking about it. She's like, what did you guys put for the function of the penis? And we were like, what are you talking about? I think she just like saw the pin wrong or something.
Oh my goodness.
But yeah, so now I'm like, well, the 5 S's.
Right. You could answer that question.
Yes.
But that's a whole nother topic, even for like our other PT, like fellow PT friends or OT friends who are going into pelvic therapy, is like, we don't even really learn that or understand that when we're in grad school. So it's amazing that like we have taken lots of classes and lots of hours of coursework that we understand this. But to think that like even as PTs walking out of grad school, like we didn't have that understanding of the 5 functions. So it's, we really have to do a good job of sharing that with everybody. So, all right. So we've got sphincter. Did you want to explain more about that? Do you want me to hold the penny pelvis?
Yeah. So, I mean, sphincter, obviously is kind of keeping things in, so that sphincteric function either closing to kind of keep continence of bowels and bladder, or then kind of opening to allow poop, pee, gas, vaginal birth, that sort of thing. So when we talk about the different layers of the pelvic floor too, I think that superficial, or first that outermost layer here, kind of that wraps around urethra, vagina, and anus. These muscles do that like closure around the holes, or then relax and lengthen open. And then even that second layer, the muscles that more wrap around the urethra. And even in our third layer, we have that puborectalis that wraps right around the rectum that kind of helps to kink the hose.
Right.
So it's really designed to help with continence, just holding back poop, pee, and gas when we're not trying to do those things, and then also relaxing and lengthening opening to allow those things to happen. So it's really a coordination of that, whether that be voluntarily when you really have to pee and you're like, oh, okay, I got to hold it in to make it to the bathroom, or involuntary of, oh, a little cough or a sneeze, or I'm running and jumping and I want to make sure that those sphincters are staying closed so I'm not leaking any gas or urine or bowel stool or anything like that. So from our standpoint, those are some of the things when we're evaluating the pelvic floor, we're kind of thinking of in terms of sphincteric function and what muscles we might be kind of looking at or assessing with that.
Exactly. Okay, so sphincter function is absolutely necessary. And I think really everyone understands that, especially going from, when we like are learning to potty train all the way until we're older. But another function that might not be something that we're exploring right away would be sexual function. Did you want to share about that? Because I think that is sometimes the most confusing when we have pelvic pain, but then also maybe have weakness in our pelvic floor that then we're then having leakage. So not that we have to go into that in detail, but it's a very kind of complex system. So
yeah. Well, yeah. So obviously our pelvis heart like houses are like sexual and reproductive organs. So the penis, the scrotum, testicles, all of that for our male anatomy, and then vagina and uterus, ovaries, fallopian tubes, and all of that in the female anatomy. So obviously sexual function involved in penetrative intercourse, or not, where even for those with a vulva, the clitoris kind of right above the urethra here, actually some of these kind of more superficial muscles help with the actual kind of erection of the clitoris, as well as a lot of the nerves, arteries, and veins that come to this area that help with just kind of the erection, not only in the male genitalia, but also in the female genitalia. The clitoris very closely resembles the penis as far as the structure, from when we're developing from little babies in utero to then kind of like a full-fledged human. So not only just housing where kind of those sexual organs and reproductive organs are, but also supplying a lot of the blood flow, the nerve supply, the vascular structures, the glands that help to kind of lubricate the vaginal opening. That happens also with arousal and orgasm. I think a lot of people are very surprised when I'm asking them, oh, how are your orgasms? Any challenges with that? And you were like, oh, you ask a lot of like, I'm not just a weirdo creep, like asking,
Not that at all. No.
how are your orgasms? But your pelvic floor is definitely involved in creating some, rhythmic kind of contractions that then help with the orgasm. So if we have a lot of tightness in our pelvic floor, some pelvic pain, or even some weakness, and less support kind of through our pelvic floor, due to any muscle injuries from a vaginal birth, any nerve kind of stretch injuries, or anything like that, that can limit the ability of those muscles to kind of communicate with all of the nerves and the blood vessels around it to, kind of have a nice, lovely orgasm. So sometimes some pelvic floor dysfunction can weaken that, or even just have less overall sensation if we're not having good vaginal tone or support through there as well. So,
and it's always a surprise to some of our clients when maybe they're coming to see us for stress incontinence, where they're jumping at, a CrossFit class, or they're jumping at a trampoline class, and they're like, oh, I'm leaking. And then that's getting better, and we're doing hands-on work, and we're educating breath work. And then that doesn't surprise me, but I think it always surprises people when they're like, can I tell you something? And I'm like, sure, go ahead. They're like, I actually have been enjoying intimacy like a lot more since seeing you. And it's because everybody lives in this same, pelvic triangle or diamond, and all of those functions do overlap. And I just think sometimes it's an added bonus, like a cherry on top.
Yeah.
But we do see people who see us specifically for sexual function, like you said, after maybe having a baby. Or I have a few clients right now who have never experienced any pleasure in that area because they just don't even know their anatomy and how it all works. And just starting to explain that from the get-go is so empowering. And you can see like eyes light up and minds start to stir.
Yeah. Well, and I think too, from like a sexual dysfunction, that can range anywhere from, pain, inability to experience pleasure or arousal or erection. And it's a lot of that, comes with a multifaceted kind of approach, where it's not just like, okay, what is like the physical kind of from a physical standpoint of the pelvic floor? Yes, maybe there's some a perineal scar that's kind of limiting the stretch, so there's some pain with penetration, or maybe there's some irritation to the tissues, or there's some kind of tightness or tension in the muscles that are creating pain with an erection or with arousal or limiting penetration. But also kind of like the mental, emotional kind of component as well. How are we brought up talking about sex or learning about sex? What did we refer to these body parts as a child growing up?
Yes.
Any, past relationships or traumas that might be affecting that now. So, and that's where, kind of bringing in our holistic kind of support team of allies to really help people overcome that and feel empowered with this part of their body, because there is a lot of guilt and shame that can be experienced over this. And like you said, just people not being familiar with their own anatomy or never having like looked at their own vulva or vagina, touched their own vulva or vagina, or even know like what feels good, what do they like, what do they not like. So
and it's different for everyone. I think that's one of the other things that's so unique about, like what we do as pelvic therapists for the muscles is one thing, but the uniqueness of how everyone's arousal tissue and nervous system perceives certain touch or certain experiences with different stimulus and different partners is also just a fascinating thing too. So I think it's that's like another conversation for sure.
and what we see in like the media and on TV and in
Right.
movies and that sort of thing. I think, sometimes people think there's something wrong with them if they can't orgasm with just vaginal penetration alone. And it's like, no, actually that's more common.
More common. Yeah. More common
I
for
think
sure.
it's like 70% of people or something like
Yeah.
that. I can't remember the statistic.
It's like, yeah, 30 or 40% orgasm with vaginal penetration, but the rest, it's stimuli through other tissue, whether it is the clitoris or even other erectile tissue that it could be as far from your vulva as your ears.
Yeah.
So
Yeah. So sometimes people are like, I don't know, is that normal? Is that not? And so that's where kind of, helping people discover that part of themselves, or providing other, resources that help people just get more comfortable kind of communicating and knowing their own bodies better. I think is a lot of very rewarding. I think I have a lot of fun kind of
I
with
agree.
clients
I
as
agree.
well, where it's like you see them like, whoa.
Right.
Yeah.
And I think that's a sign of a great therapist is to be able to be inquisitive about those things, even if sensuality, desires, and sexuality might be different than what we experience or what you might experience with a pelvic therapist that you're talking to. But your pelvic therapist, for anybody who's watching, should be asking those questions, even if you're coming to them for back pain or something.
Yeah.
There's so much function there. So great point. It's a huge and a lot of the time underlooked function of the pelvic floor.
Yeah. Well, I think like besides the obvious,
Right.
Yeah. So, okay. And then the third one that I think I said that like maybe some people might have thought of is support. So like support specifically for like our pelvic organs. So do you want to tell us what those organs are?
Sure. So inside, I'll show you inside the pelvis, from the pubic bone back to the tailbone. I don't have my little bladder and rectum with us, but there would be.
I have them. I'll do them while you're talking.
Yeah. So from the pubic bone back to the tailbone, there would be the bladder first. Then snuggled behind the bladder for our female anatomy would be the uterus with our sweet ovaries and fallopian tubes off to the side. And then there would be the rectum kind of snuggled behind those. Exactly.
So front to back.
Exactly. Front to back. And there's lots of support ligaments and fascia and connective tissue that hold all of those guys up. And that can be challenged for some people during pregnancy. It can be challenged during the birth process. Most of the time when we talk about support function of the pelvic floor muscles, we're talking about how the muscles are holding up those organs and how that supportive structure keeps the organs in place where they are. But sometimes after injury or even atrophy, if somebody was really down and out for a while, there can be laxity within that tissue. Whether it's laxity that then the pelvic floor muscles don't have as much oomph to hold everybody up, or there could be something that there is an actual mechanical change to the tissue that holds the organs called a prolapse. And I think a lot of clients will go to a lot of clients who are experiencing a prolapse will go to a gynecologist, and the gynecologist will say, well, just do your kegels. Well, kegels are part of it to some degree, but they're not going to step in and kind of overtake the role of the supportive tissue like the ligaments and the other fascia that help to hold up our organs. Think of them in such a way that they're like so organized and dainty, like you just showed us in the anatomy, but they're not. They're expansive balloons of our bladder that kind of expand and contract with having a fuller bladder and then eliminating. Same thing with our bowels, expand and contract. And it's this never-ending balance of how that all those forces interact with each other throughout the organs, but then also interact within the pelvic floor and the fascia. So it's definitely important for that support to help hold everything up, but they're not just the lone rangers. They have other partners that help hold them up. We can, in some ways, overcome some of those pressures if someone was to have a prolapse with pelvic floor strategies like doing a Kegel or strengthening of the core in general, but it's never just on its own. So
well, I think Yeah. I mean, just to the point of your Kegel, I had someone this morning who was having some pelvic pressure symptoms and a little bit of prolapse. And you test her pelvic floor strength, like just having her do like an isolated Kegel. She has a totally fine, strong, healthy pelvic floor contraction.
Right.
But like you said, there's so much that goes kind of beyond that, where we kind of come in of how our support system is supporting us with the other connective tissues, and our whole core system as a whole in our pelvic girdle. And another piece of that support system is this nice little like perineal body here.
Yeah, my favorite.
Yeah. That's literally, it's a bulk of all these muscle tissues kind of coming together that kind of forms that little bridge between the vaginal opening and the anal opening too. That's part of our kind of like support system of our superficial perineal body, but then also deeper in through, as something that when we're observing the pelvic floor, we're looking at the positioning of this perineal body to kind of give us some indication of how is the support kind of beneath from these pelvic structures based on the positioning of the perineal body and what it kind of looks like as well. So,
and two, when we do just observe that area, but we also might have, I like to say, oh, let's see what the posture of the pelvis looks like. But we might also want to see what the function looks like. So when we ask our clients to cough, we're also taking a peek at the perineal body that you were explaining, Dr. Becca, to see, does it have give, and how much give does it have with intra-abdominal pressure? And that intra-abdominal pressure is what challenges the support of the organs and the pelvic floor to see, all right, how quick and abrupt can that pelvic floor musculature support? Or is it delayed, or is it like lacking? Is there an additional challenge there that needs to be looked at? And that can definitely be something from birth injuries or even a back injury. If somebody has nerves that have been injured from their back and that innervate the pelvic floor, it could be too. So yeah, a really important one that we don't think of until you have felt some laxity in that area.
Yeah. And then the fourth, which I think is a fun one, is the stability portion of it. So that is how the pelvic floor is part of our whole core system and helps to provide stability not only to our pelvic girdle itself, but also our like lower back and trunk as well. So
yeah, and I think when people see us and they're reporting back pain and hip pain and things like that, and maybe they've seen another physical therapist, an orthopedic therapist perhaps, and they're doing all their glute bridges and all kinds of things, and they come see us and we're like, oh, there's a portion of the pelvic floor that's not holding up its end of the bargain to help stabilize the bones and stuff. People are like, wow, like that got me that last like 25% that I was looking for to feel better with that stability of my core, or even of my tailbone or of my hips. So another one that a lot of people will recognize. They're like, wow, I feel so loosey-goosey when they're pregnant. I'm like, yeah, there's a lot to that too, but that can be the support of the muscles or strength or lengthening. And with that length, there is a little bit more laxity within the support.
Yeah. Well, I think a lot of the education that we help to provide is how your pelvic floor is part of that overall core system to provide that support and stability. So if someone's coming to see us with a diastasis, or that abdominal kind of like stretch or separation, why would we want to do an internal pelvic floor muscle assessment if they're like, I just need to like, tighten things up a little bit.
Right.
But I think a lot of people use the analogy of like the core like canister system, where the top is your diaphragm or your breathing muscle, the bottom is your pelvic floor muscles, front, side, back walls are all the traditional, what you probably think of like core muscles of your abdominal muscles that have multiple different layers, and your back muscles that also have multiple different layers within that whole core system that help to manage our pressures. And pressure is not always a bad thing, right? Like we need pressure to create stability, but it's how we're kind of distributing that pressure that will then kind of help to determine, is my diastasis kind of healing? Am I having leakage? Am I having a prolapse? Am I having pelvic pain? Am I having back pain? So if anything within that whole system is kind of off, it can then trigger that like cascading response of the whole system just not supporting us, providing that stability as well. And, you know, I think a lot of what we kind of work on and start with is the breath in that diaphragm that really does help to kind of drive the whole system from a pure, just kind of like pressure management standpoint, like that pistoning system, so that when we inhale, if our diaphragm actually does kind of contract down and lengthen, that allows our pelvic floor to do that nice lengthening response that you were talking about, of how well does it kind of absorb that pressure coming down, so that when we exhale, that pelvic floor can kind of lift with it, and we get that nice kind of pistoning pressure management system. And then our rib cage, our back, our abdominal wall is doing the same thing in like a 360-degree fashion, where it's expanding and then contracting to kind of create that positive pressure that we need to then form stability.
Yes.
But if there's, let's say we have a really tight or tense pelvic floor that's not lengthening well, and we just had a baby and there's a little bit of stretch or weakness through the front of our abdominal wall, where is that pressure going to go if it's not able to kind of lengthen into the pelvic floor? Well, it might go to the path of least resistance, which is out through the abdominal wall. Therefore, you're having a really hard time healing that diastasis, even though you're doing all the, you know, diastasis postpartum programs and exercises and that sort of thing. So that's where I think the fun part of it comes in, with really helping people make the connections of how involved your pelvic floor is within that whole system.
Exactly. And with that pressure and that being able to support, like you were talking about, the breath pattern coming down, that also is 100% necessary for our bowel health too.
Mm-hmm.
And I think people forget that allowing their core to breathe and to stabilize in that efficient manner of expanding and contracting just a bit, not contracting by squeezing belly button to the spine, but that little kind of like breathe, like literally like breathing. If you watch
Just
like
natural movement.
Yeah, natural movement. Like watch your cats or your dogs.
I love watching Leroy and Jerome breathe.
Yes. I was gonna say chickens don't do it as much. I can't really see it on them. But if you watch just how your pets breathe, that natural, just little inhale and exhale, it's what's helping to move and motivate, you know, their spines, their hips, their backs, but also like their digestive system, and as well as their lymphatic and vascular system, which might segue just perfectly into our last one. What a team, setting each other up.
Yes, the Sump pump. It's your favorite.
It is my
Why
favorite.
is it your favorite?
It, you know, I think one, it's my favorite. Well, when you're in like your first pelvic floor class, like they tell you all these functions, right? And you're like, yeah, I get that. Yeah, like let's prevent leakage and let's have pain-free intimacy. And then they say like, and sump pump reaction. And you're like, oh, okay, all right, move on. And like that's as far as it gets. But when you work with the human body time and time and time again, whether someone is pregnant, like one of our gals this morning, dealing with some varicose veins that are really popping, or even with some of our male clients in the past who have had erectile dysfunction, it's the sump pump action that is getting a challenge or that is lacking somewhere. So the sump pump kind of comes back to what you were talking about, Dr. Becca, with the breath work, that from the diaphragm to the pelvic floor, they have this kind of ebb and flow of positive pressure. But what that also does is stimulates the pressure in the sheaths around the vasculature of the pelvis. And we have a ton of vasculature in the pelvis. If you remember anatomy, and I think I have it in another video, but from way up at like the heart, right? We have these long aorta, like our long descending and ascending aortas that come down. Well, they split. Whoop, losing the front of my vulva. Hold on. They split like right here in the sacrum. which then creates like the external iliac, internal iliac veins and arteries that then go down into each side of the pelvis and down into each leg and our limbs. And it's the pelvic floor that helps to move that back up to the heart. Once everything circulates down and away, if you think of our arteries, they have a lot of elasticity and can really move and push lots of pressure to move our blood flow from our heart down to our legs, out to our hands. But when we go from our legs back up to the heart, it's a lot of work because it's going against gravity. And those veins have some elasticity, not as much as our arteries, but we rely on the muscles. So when you think of visiting maybe your little old auntie or your granny, and maybe they were in the hospital and you see a therapist or a nurse say, do ankle pumps, it's because you're trying to get the muscles to squeeze and pump the blood flow back up to the body. Or if you sprained your ankle and you have a swollen ankle, do ankle pumps to get the lymphatic system to move. Well, if you can't, you can pump your ankles to get your calf muscles to move the blood flow, but it's got to get taken up somewhere else. So the pelvic floor muscle acts as a pump to keep pumping and lifting things back up. So sometimes in the very early phases of postpartum rehab, or even during pregnancy, we'll tell people, do little squeezes of your pelvic floor to almost act as a pelvic pump or like an ankle pump. If you've had swelling from a surgery, if you've had swelling from a perineal tear, or for some of our clients who are having maybe sexual dysfunctions or challenges with an erection, whether male or female, doing some pelvic pumps to help pump the blood flow, whether it's through and into the penis or to the clitoris, to help maintain that pressure there for that blood flow, that is what we need the muscles for. So that's why I just love it, because it touches on like other systems of the body that we don't always think of.
Yeah. Or even with that, if people who just feel like a fullness in their pelvis, either after, sexual intercourse, or they've been on their, maybe they work a job where they're on their feet for a long time, or they're out going for a walk, and maybe, there's some challenge to that vasculature of getting that blood flow back. For whatever reason,
right?
That's something that people sometimes experience as well, where it's funny. I feel like I've heard you Amanda, tell your clients like, okay, after like intimacy, go for a walk.
Yep. Or do legs up the wall.
Or legs up the wall.
To assist
or like
that blood flow.
Do some like heel raises or that sort of thing, just to help kind of get the blood flow. Because a lot of blood flow does come to the pelvis during those types of activities. That if there's a challenge to the vasculature, there might be some stagnation of blood flow, which can create a lot of kind of congestion or pressure or fullness kind of in that area. And even some little gentle kind of like hands-on techniques that we kind of can do with our clients, or even teach our clients to incorporate, as far as almost encouraging some of that lymphatic flow or that blood flow back up to the heart, whether it be someone during pregnancy who's experiencing varicose veins in their vulva, or just having more of that pressure heaviness kind of fullness, or challenges with erection, or anything like that, of like, okay, how can we start to kind of move some of that blood flow along, not only with the muscle function, but even with some of the gentle kind of lymphatic techniques that we can use, because those are very superficial, those lymphatic vessels that help to kind of take some of the fluid and the junk out of our blood and kind of filter and circulate back up to our heart as well. So
yeah, I think that's why I love it. It was, like I said, it was one of those, just, it's a function, it's there. Yeah. But the longer I've had the experience, which will be, oh my gosh, like getting close to 10 years now of pelvic health. And it's like, wow, like that I find more often than not, we need to address from the beginning. Then we get to like kind of move everything else along within those different functions. But I think that's for us, I'm so grateful for you, Becca, to have, you in our practice, and to offer you as well the time to, and myself, the time to be able to spend with our clients, so we can figure out, what function is really, the driver of all this, or is it very multidimensional, and we have to look at 4 of the 5 functions. We consider that.
Yeah. Well, I think the whole general theme, which this is like one of the other like points that, when I was preparing for this conversation was that, the pelvic floor functions as part of a whole system. Like even within the 5 functions of the pelvic floor, there's multiple systems. There's your genitourinary, your GI, your musculoskeletal system, your nervous system, your cardiovascular system, your respiratory, endocrine, like all the systems.
All of them.
So as pelvic therapists,
correct.
It's so important that we kind of look outside, we step outside of the pelvis and just recognize what is the pelvis's function in, whatever this person's having issues with, be it bowel, bladder, sexual, pain, whatever it is.
Right.
What is the specific function of the pelvic floor that might be affected, but what other systems does that feed into that we need to kind of take a look at and make sure that we're addressing as well.
Right.
So.
And that's why, if anyone has experienced being in our office or has the desire to maybe come into the office and see what we're about, is like, we might take your blood pressure. We might also do a sensation check. Mm-hmm. That might be like, oh, is this, I haven't used hot or cold in a while, or is it like lighter or deeper touch, where I want to see, what does someone's skin look like? Is it super purple that's telling us, whoa, this Sump pump action is overwhelmed by blood flow during pregnancy? Or is it that maybe things look really pale and we're not getting enough blood flow? And there's many things that holistically we can be working with other providers to say, hey, could you check out their cardiovascular system and make sure that's healthy and safe for them to continue on to do whatever? Or even, what does their hormonal system look like? When we talk about more white or lightened vulvar tissue, or on the opposite, sometimes even red tissue, we start to think, is there an estrogen thing? And we don't have that same, I'm going to call it a privilege, honestly, when you and I maybe used to treat shoulders and maybe knee replacements. Like, we didn't get that intimacy with all the other systems to then be able to direct people to the next provider that would be, benefiting their endocrine system, like you were saying, or their GI system. So it's a really cool privilege. It's just so neat. And I love putting it all together. So, Thank you for this idea.
Yeah. Well, and like so many times people are like, and I don't know if like you could help with this.
I know.
Like also. And
like, bring it on. Bring it on.
This. I mean, I may need to refer you for like some things. But or like, I don't know how much of this like you can like help with, and at the end of the day, like, we're still physical therapists, right? Like, we still have all that knowledge of how all of our systems, our body systems kind of integrate, and even from like a psychosocial approach too, as far as like the mental, emotional kind of awareness of like, what is your support like at home? Like, how much sleep are you getting? How's your job? Like, what's your relationship with your mom? Like,
exactly.
Like,
what shoes are you wearing at this season? That'll throw off things too.
Right. Yeah. So kind of really appreciating that. Yes, we do have the privilege to kind of talk through those things. And a lot of times, we feel like a therapist, like in the general sense of, like, we're the only people that are asking, like, hey, you have a new baby, like, who's helping you? So I think it's, it is truly a privilege. Something that I always felt was, when I was first kind of starting out, like, you feel this like guilt and like shame over like not being able to kind of dive as deeply as maybe you want to, and not only just because you're a baby therapist just starting out and you're just trying to remember like, what are the special tests of the shoulder,
exactly.
But then truly, yes, having the time to sit in a setting one-on-one with someone where there's not like 1,000 other people in the gym kind of moving around, where we can really have these like conversations and allow people to feel comfortable to talk about this stuff, because it is a very vulnerable, thing to be able to open up about your pelvic health.
Oh,
So we're so grateful to all of our clients that kind of trust us and are willing to be vulnerable and work with us. So
yeah. And if anybody's watching and has any questions about their 5 functions of the pelvic floor, feel free to send us a message. Our email is info@breathelifept.com. Our website is www.breathelifept.com. And all of this will be in our YouTube info below. But yeah, feel free to reach out. And if we're not near you, we will help you find a therapist near you as well.
yes. All right. Thank you, Dr. Amanda.
Thanks, Dr. Becca. Great work.
Thank you. You too.